Okay, good. 2, that's good. And how many are scheduled for second ones? Yeah, me, 2, yeah. All righty, so you ready? Okay, all right. We're very happy to have Jeff Bowman here with us, Chief Executive Officer of South Central Kansas Medical Center. I remember first calling Jeff probably a year ago, and of course, you know what was happening, pandemic, things were very busy for him, so he had to give me a rain check, and so today, see, it's raining and everything is perfect. And then a while back too, I did email him. I wasn't sure why he wasn't responding, because he had in the past, and it turns out he had gotten COVID and gotten sick and in the hospital, so you probably share a little bit about your experience with that. But anyway, we're real happy that today is the good day for him to be here and share about what he's been doing down there at the facility. He's currently Chief Executive Officer at South Central Kansas Medical Center and the health clinics Winfield Medical Arts, SCK Midwives, Ark City Clinic, Summit Clinic, and the Ark City Urgent Care. He began his current position in August of 2018 as interim and became the official CEO in November of 2018. He grew up in Ark City and graduated from Ark City High School. He then attended Baylor University in Waco, Texas, earning a BBA in Marketing, Finance, and Information Systems. And I'll let you read the rest, but he's been very, very busy since then and comes to us with tremendous skills, and I am so glad they hired you away from TrensWise. At least he thought temporarily. We don't know about that. But they've been keeping you very busy since then, so we appreciate you coming to talk with us. And I'll get you this little instrument here going, and you can advance your slides. But
awesome.
They made a great pick. I know they did.
Well, thank you. Well, I appreciate the opportunity to talk with you guys today. I think one of my strengths has been that I really enjoy working on organizations or working on companies that need some work on them, if you will. I bought a Caribbean medical school with my partners that had 2 students, and within 3 years we grew it to 142, and I sold that. When I got, do you mind if I take it off?
No, that's fine.
Distance from everybody?
Yeah, sure.
But when I got to Ark City's hospital, South Central Kansas Medical Center, I made a joke. I said, it's almost like Noah's Ark in the middle of the desert, and I'm trying to move it with 1 bucket of water at a time. So now I've pushed this right at the top.
Yes.
You turn it on.
I did turn it on, honey.
All right. So when I arrived August 20th of 2018, the hospital had been losing money, over $1 million every year, and one year was like 1.9 million for the 3 years prior. As a city-owned hospital, we all know that that is definitely not a maintainable model. So we walked in, and there had been an EMTALA violation. All the infrastructure on the internet and everything, the phones were down. There was a lot of band-aids that had been done. Nothing was fixed properly once they moved into the building. And so with the EMTALA violation, typically there is going to be some sort of monetary value fine to it, $250,000 to $1 million, etc. So when I was working with the CMS auditor, I just was very transparent with her. I said, at this stage, if you find this, we'll probably close this hospital. So we worked through the plan of correction. We didn't have a fine. It was just an amazing experience to go through a federal process. It's very difficult and come out on the other side above. We were also in an outsourced research lab program. They had enrolled in it, and for a lack of better words, it was probably a fraudulent type program. They were trying to sell the hospital that this was a legitimate program, but they were funneling labs through a lab in San Antonio, and it was just a mess. So I've been cleaning that up. But as the clinics had dwindled through the years, you can see Ark City at one point in time, the Ark City Clinic alone had 10 providers and a nurse practitioner in there. we were down to 2 doctors and a nurse practitioner in the Summit Clinic, and we had 4 doctors in Winfield Medical Arts. The hospital was short-staffed across all departments. We weren't even able to run the radiology department full-time for MRIs. So one of the first things that I jumped onto when I came in was Sherry Bain. September of 2018, I hadn't been here 3 weeks. I hired her to come to Winfield Medical Arts. There was a lot of opportunity there for primary care, female to be able to see children, and women's care as well. We also recruited the Walnut Valley foot specialist, Dr. Lyman and Dr. Elliott. They were coming into, I said, could you guys come in? Anything below the ankle in the emergency room, you can come and treat. They were just given privileges to do surgeries there. And we also fully staffed the radiology department in this same time period. It was interesting to be the interim CEO. I was making changes, and I would come in the middle of the night to meet people, just trying to make sure that I got to see everybody, get a good feel for the organization. And one time when we were talking, one of the employees turned to me and said, we appreciate that you're here and trying to fix things, but you're going to leave. And I thought, oh my gosh, I am. So the board had reached out to me and asked me if I would consider staying as the full-time. And after the feedback came through and working with the people that were there, I was really almost called, if you will. I knew that I needed to stay here and try to help them, because these are people that have worked in the hospital for years, hadn't received raises, there wasn't a real direction for the facility, and it was a compliment to me. One of the employees said, until you came here, I've worked at this hospital for 8 years, I've never told anybody I worked here. And so I accepted the position on November 15th. We had increased surgeries, and we ended that year for the first time in over 3 years with a small profit. We were about $480,000 in profit. Then we moved to, I didn't change slides, I'm sorry. So this is called caught up. We ended the year with a profit, as I was talking about. So 2019 came, and Heather Irving had been working in Winfield in pediatrics and family care again. She came to me, and we had an opportunity to work together, so we placed her and hired her in Winfield Medical Arts. In 2019, we also had a debt to the city of $1.3 million that we paid off to become debt-free. We worked to improve the community perception. I've been intrigued on Facebook. I don't know if you guys use Facebook a lot, but Facebook is just a way that everybody talks about everything, good, bad, and indifferent, and a lot of bad.
Yeah.
So I actively got on Facebook, learned how to operate it, and then would reply to complaints or issues. A lot of times it'd be as simple as saying, somebody may be discussing a personal situation at the hospital, and I share with them, I appreciate the opportunity to talk to you, but I can't do this publicly with HIPAA. And that really helped a lot to get the trajectory changed on social media, if you will. We weren't being bashed all the time. And so that was my attempt to change the perception of the community. And after a year, we've been here a year now, I would tell them, if you haven't been to the hospital in a year, you haven't been to the hospital, because there's truly been that much of a change. We operated 2 ORs for the first time since the hospital opened in October of 2019. The hospital also ended this year with a profit, and during this time, the third and fourth quarter, we're working on strategies for the next year. So February 15th, the Ark City Clinic, which was established in 1923, it's the oldest clinic in Ark City, was down to 3 providers, and we added them to the South Central Kansas Medical Network from Alliance Health. They came back and became part of the hospital. So we had Dr. Paul Clausen, Dr. David Schmeidler, and Dr. Mauricio Herrera. The next thing that we felt that we needed to do was to start the urgent care. So we started the Ark City Urgent Care from 8 to 8, Monday through Saturday. This was twofold, because there were patients that needed to have care more affordable and not have to use the hospital as their primary source. So this was an amazing addition. It's funny though to me, there's still a lot of people that don't know that we have an urgent care at the Ark City Clinic. So we've been working on a lot of the marketing and advertising. March 2020, COVID. 1 year ago today, the Sumner Regional Medical Center closed. We're hearing all the rumblings of COVID hitting both our East Coast and West Coast. And with that hospital closing, in the radius of Winfield, Ark City, and Sumner, we lost over half of our beds in 1 day with them closing. So I reached out to the Kansas Hospital Association president at the time, and I told him what was going on, and I said, well, we're getting ready to go with our ICS unit. As you can see, on March 17th, we implemented it, the Incident Command System. I said, I would like to work with you. I knew the organization that had shut down the Wellington Hospital because I'd worked with them about a decade ago. And I said, let's see if we can figure out a way to make that our overflow hospital. If we got to that situation that we had to. So we worked with KHA, KDHE, trying to see how we were going to make that happen. But we were blessed that we truly didn't ever have to. There was an opportunity most of the time for us to be able to, if we had to transfer from Ark City or Winfield to Wichita, that Wesley or St. Francis was able to accommodate our COVID patients. At the same time, there were times that we couldn't. So we literally at one point in time had to convert one of our wings to a COVID unit. We had a 4-unit isolation unit, and then we had 2 other isolation rooms that we were able to use, but we had so many patients that we couldn't transfer out at one time. We had to convert a 12-bed wing to COVID. We had people that we would have to, when we couldn't get into Wichita, send to Oklahoma City, Denver, and Missouri. So it was a really stressful time. The stay-at-home order, which in hindsight we can all say it was probably too early, but it really did dramatically hurt the healthcare system, because once you have a stay-at-home order, people just don't come. We didn't have any radiology patients. We had stopped elective surgeries. Our patient visits, the whole schedule would be 90% of the schedule is wiped out. We were trying to implement it, and we did telehealth in the past, but a lot of people didn't want to try it. So in a 3-month time period, we lost $5.1 million in patient revenues. So at the same time this was all going on, we couldn't qualify for the PPP money for the payroll because we were a city-owned hospital. And so I'm shy and bashful, so I got hold of the Kansas Hospital Association. I called Senator Moran's office. I called every politician that I could get to. I was actually surprised. It ended up being Senator Moran's office that reached out to me. We had a couple of Zoom meetings. He actually nominated me, and I was one of the 323 hospital CEOs nationwide that was interviewed by the OIG for Health and Human Services for their report to make the plan of what we're going to do for COVID. And that would have been the third week in March of 2020. I just did the same on the second wave of the interviews. I was selected again and did the interview for three weeks ago. And that's where I made it very clear that one of the biggest problems that we in rural America have is staffing issues. It's not that we don't have beds, we can't afford to pay $125 an hour for a travel nurse, and that's the going rate for a travel nurse now. I have a respiratory illness, and I've been understaffed in my respiratory therapy department since I joined the hospital. It's very difficult to get people in those type of positions to come to rural America. So I shared with them that I have one respiratory therapist that I literally pay 24 hours a day, 3 days a week to work, and she sleeps there because that's my band-aid to be able to treat patients and provide the service that we need to. So you can imagine the exorbitant amount of overtime and stuff we're paying during all this with travels and paying employees overtime, so you have to live at the hospital. The one thing that we didn't think about that was going to hit us really hard is because, remember, I told you at the end of 2019 we were going to the growth stage. So we've added the Ark City Clinic, we've added these new providers, And all of our supplies were based off of the previous year's allocation when we only had 7 providers total. Now, we've already added Sherry and Heather, Ark City Clinic. We already had Molly Harris coming. Molly was a great addition to our family because she was born and raised in Ark City. Her husband's a dentist. They finished school and they're coming back to Ark City. So we hired her. Tammy Cullen had worked for our network and also worked in the urgent care in Winfield. So she came over. Then we'd already hired the orthopedic surgeon that was supposed to start April 1st. So he starts April 1st, there's no elective surgeries, and we're in the shutdown. Now, not to oversell him, but he is the most dynamic surgeon I've ever met, most compassionate, and even with COVID and the surgery being delayed, he did 152 surgeries in 7 months. He's not the type of orthopedic surgeon that's going to jump into surgery though first choice. He's going to review your history and look at all the other options before he moves forward. He was a surgeon with in Liberal, Kansas for 20 years. He was the preferred orthopedics for natural beef out there. So I was like, okay, perfect match. We got Creekstone. But he's just been a huge asset to our hospital. We also hired in August of 2020. He was already in the pipeline. Dr. Jose Hinojosa, he would join the Ark City Clinic. So you can see I'm adding all these doctors while patients are declining. It was very stressful. We also had added the midwives from Winfield. They were coming over in November. So the SCK midwives, they have the birthing center in Winfield, and then they also see patients in Ark City at the Ark City Clinic. Do you guys know Tarina? Tarina is
I know of her.
bigger than life.
Yeah.
She has the heart, for women's health, it doesn't matter for anything else. Her patients are always going to be first. They delivered 300 babies the previous year in 2019.
Wow.
And we've already, the birthing center typically is a little bit, we expected the volume to be a little bit less there, but it's not. We delivered 12 babies there in January. And so they're delivering at both hospitals. That's going to be one of my continued efforts. As long as I'm here, we have to figure out a way for Ark City and Winfield to work together. When you know that every dollar that's generated in healthcare, 59 cents goes to the community, it is insane that we don't work together and transfer, because as a critical access hospital, if they're on diversion, it makes sense for them to transfer those patients to our hospital on Med-Surg, and then we can take care of them instead of going to Wichita. Same thing for us. We have a very small ICU unit, so whenever we need to transfer ICU, we transfer to Winfield. So we always need to work together to keep the money here in our county. The end of 2020 ended with what I consider a huge success, because we did over 100 surgeries in 1 month.